Okay, so as I mentioned earlier, this is one of a series of interviews that that the Service and Outreach Committee of Old South Church is doing with our current and recently passed grantees, so about what their mission is and where where and how they work, how the pandemic has affected the work that they do, and then how can Old South community members become engaged in the work. So that's kind of the scope of what we're trying to cover. So I have with me from Healthcare Without Walls, the founder, president, and chief medical officer, Dr. Roseanna Means. I have a nurse practitioner for Bridges to Elders from, I believe, the Women's Lunch Place, Jeannie Chou, and the case manager for Bridges to Elders, who is Adelina Vega. Did I get that right?
Yes, you did.
Excellent. Excellent. So I'd like to start with you, Dr. Means. Could you tell me a little bit about what the mission of Healthcare Without Walls is and what type of work that you do?
Hi, and thank you so much for asking us to be here today. We love having this opportunity, and we're very grateful to the Old South Church and the congregation of Old South Church for hearing about our story and what we do for the women who are unhoused and poor in Boston. I'm a physician. I've been on the medical staff at Brigham and Women's Hospital for 40 years, and I started working with homeless persons in 1990 with Healthcare for the Homeless, and then started my own program specifically to targeting women in 1998. That became Women of Means in 1999. That's when I became very close with Kip Tiernan, who was a former member of your congregation. And we changed our name to Healthcare Without Walls in 2015. The mission of Healthcare Without Walls is to improve the lives of women who are homeless or marginally housed through high quality healthcare, education, and advocacy. And we do that by sending mobile teams of nurses, case managers, community health workers, and volunteer physicians to shelters where women go during the day to get daytime services, and to offer them free medical care, care coordination, medical supplies, and other point of care testing like diabetes and strep and pregnancy and so forth. We also have outreach programs for specific targeted groups within that population, women who are 55 and older, who we treat through the Bridges to Elders program, and women who are pregnant and receiving maternity care at Brigham and Women's Hospital through a program I started there called Bridges to Moms. And these programs are phenomenally successful. We are not the primary care provider for these women. We are what we call the gap care or adjunct care. We've found that what happens between the medical center or the health center or the doctor's office and the real-time community, the real-life community of these individuals is full of challenges and obstacles and barriers. And sometimes the women can't keep up with their primary care provider appointments, or they can't get there. They can't speak the principal language of the people answering the phone. Their lives are chaotic. They're going through depression or trauma. And so we found that in a population of vulnerable persons, namely the women that we take care of, that having a team in the community that meets them in intersection points where they're already receiving services, we're able to provide better continuity of care, and improve health outcomes, save emergency room costs, improve health literacy, and really change the trajectory of the women's lives. Over the past 20 plus years that we've been doing this, we have many success stories, and a team of individuals, clinicians, who have been doing this work, some of them literally for decades, volunteering their time and giving of their time out of a dedication and commitment to these women. The women come from a variety of shelters, overnight shelters here in Boston, namely Woods Mullen Shelter, Pine Street, Kingston House. Some of them stay at Rosie's Place, which has about 21 overnight beds. of these women come from the streets. They sleep outside, they sleep in church doorways, or they sleep in alleyways behind dumpsters. Many of them of the older women have very, very difficult life circumstances. Adelina and Jeannie can tell you about those circumstances. But the common thread through their lives is that they're isolated, they're lonely, they're scared, they don't know how to navigate the healthcare system, they don't know where to begin, they don't know who to call, they don't know how to reach out. There's an enormous amount of shame and fear and misunderstanding and confusion, and we break it down for them and show them how to use the system and close the gaps in what people call social determinants of health, so that they can move on with their lives. The result are, as I say, many, many wonderful stories of successes, little babies that we get to hold that have come through full term, mothers and grandmothers that are moving into an apartment for the first time after many years being out in the streets, and women who have moved on from lives of drug use or alcoholism or mental illness and are getting their lives together. So I love my team. I love the women and the one or two men that are volunteers with Healthcare Without Walls, and we feel incredibly blessed and grateful for the opportunity to change these individuals' lives.
That's pretty amazing. Thank you so much, Dr. Means. Jeannie and Adelina, I'd like to, one of the programs specifically that Old South grant is supporting is called Bridges to Elders. And I was just wondering if Jeannie, if you could take a second and tell us what that program is, and just tell us how it works.
Hi, Marie. Thank you so much for having us again. So Bridge the Elders program, we are a comprehensive program that is bridging between the vulnerable elderly women to the healthcare clinics, other healthcare clinics and the facilities, and connected with them the systems that a lot of women do not know about. As Dr. Means just shared, many women are lonely, they are abandoned, they feel abandoned, or they feel there's a lack of supports and systems. They are unaware of a lot of things. So Adelina, who has a lot of trainings in Social Security benefits and mass health, Medicare, how to get the benefits, SNAP benefits, all the things, that she would connect with them. So through the program, we focus on the social determinants of the health. We do very thorough assessment when we see those vulnerable women at the first visit. Sometimes it may take a few days or a few months to really get to know them and have them open to us until we have a better understanding of how we can help them and set up goals with them, and they will let us know what their needs are, and we can identify with them and then work step by step. The social determinants of the health it would help us to guide through. So we're going to find out whether they have health insurance, what kind of health insurance do they have, mass health, Medicare, some private insurance. If they don't have any insurance, we will find out if they're eligible for some health insurance that are available for them. And the housing situation, which is very big. A lot of women would be living in somebody else's house, couch surfing, doubled up, or on the street. There's one lady that I know, she would live in the bus stop. She has her own bus stop area that she has been living for over 10 years. And some ladies would live in the shelters for many, many years, under the bridges, church doorsteps, in front of a library. We've seen all this, ladies before. So it takes some time, and also the housing is not very available to us. It takes months to years. Some cases it would take 3-4 years. We don't know when they will have the housings available for them, but we would help doing the housing search and find out. And the other social determinants of health, such as the food security and the transportation, and whether they are safe where they are. A lot of women actually have a history of domestic violence. They do not feel safe. And if those safety issues are not addressed, we cannot find them housing, or they would not be able to really open up to us what they need. And whatever they are, we will try to meet where they are and start from there, one by one. And Adelina has been just amazing community health worker who has been she just pours her heart and soul to go after these ladies, and she does such a beautiful job. And the connection that she has with them is it just really warms my heart each day.